Great. Okay, well what we're talking about now is social stories, which is one aspect, of course, of our work in the speech pathology department. And most people think of either language skills or speech sound skills, especially for speech pathologists. And part of our role, actually with families, is exploring with them what speech pathologists can do. And a big area that they're not aware of is this area of pragmatics, the social use of communication. Now, pragmatics comes from the Greek word praxis, which means to know what to do or to do. And we get our word practice from it, and also practical. And I often use the analogy of a birdhouse. People might know what a birdhouse is, and it's made of wood, and you use hammer and nails to make it. But if every time you go to make one, you cut your finger, you hit your thumb, or you use the wrong materials, you're not very practical. Same with pragmatics. A child may be able to produce all the speech sounds there are, they might produce all the grammatical structures and all the different types of sentences, but if they don't put it in practice the right way, the end result can be disastrous. For instance, a child might be able to say the sentence, "Excuse me, miss, can you help me with this work?" But if they never put up their hand and ask for help, then there's a problem, it's a pragmatics problem. And so sometimes I use the bubble analogy. Speech pathologists who I talked to 30 years ago use the analogy of a bubble. You know, speech pathologists, they go into the nitty-gritty, the little bits, just as a person trying to describe a bubble might describe the soap content of the bubble. They might discuss the length and breadth of it. But if they don't describe the movement of the bubble through space, they're not really giving an accurate picture of what happens in real life. It's the same with kids and people. They exist in a three-dimensional world of other people. And if we don't describe or find out what they're doing in relation to those other people, we give a very flat, a very narrow, and sometimes an inaccurate picture of what is happening for them. So when you're looking at a very young child, there are basic seed skills that grow into a big variety of other skills. For instance, getting other people's attention, responding when people call their name or try to get their attention, requesting things or requesting actions of other people, responding to the requests of other people, seeking information, giving information, and just commenting about the things that they like. And a baby can do these things, an infant can do these things, but as the child's getting older, more and more is expected of them. So if they're acting as if they were a much younger child, they can be pragmatically inappropriate in the different situations. And there have been, and I've seen them, speech pathology programs created on what to do in a job interview, how to ask out a girl on a date, for instance, how to respond when someone tells a funny story, that sort of thing. We don't get to work on those things here, but a lot of other things we do work on. So obviously we want to observe the child in the clinic room, but the clinic room is not real life. So we have to have a conversation with them, we join them in play, we might observe them over the Royal Fairweather School, but chiefly we're seeking the family's viewpoint. So they fill out questionnaires, sometimes rating scales. We're looking for any unusual behaviours or poor abilities because we want to focus on the chief things that are causing the child the most friction in the family environment or in the school environment, the most hassle, the most trouble in their life. And then in discussions with the families we decide on our initial priorities for therapy. So there are children who are very negative in their interactions with other children, for instance. I would just take this child as an example. And the way they're acting is very prickly, very uncooperative, they might be very demanding. Or you can have children who are very withdrawn, who don't have much to say in a conversation, for instance, who don't stand up for their legitimate needs and rights. And you can have other children who are always interfering in the other children's activities, knocking over their play equipment, pushing them, because they don't know how to interact in a positive way. They're trying to interact, but they're reacting to the other children's negative views of them because their social skills are so poor. So the root of the problem for pragmatic skills is the child's reduced awareness of others' expectations and the reduced insight into others' reactions to their behaviours, and sometimes a reduced valuing of the emotions of the other person. So I often use this analogy of a cup of coffee. If I go back down to my back fence with a hot cup of coffee, and I'm drinking the coffee, and I decide I don't want to drink it all, and I throw it on the back fence, the meaning of my action changes if I know that my neighbour is standing on the other side. Because if I know that they're there, then what does that say? I don't care that they're going to be covered in scalding hot coffee, right? Perhaps, or I don't like them. But if I don't know that they're standing there, then my action has a completely different meaning. Same with children as well. They can be doing things and not knowing that they're stepping on the toes of other people. I had a child in cleanliness once, and I went to the school to work with him, and one of his major problems was his tone of voice. So people would give him a job to do. He was 10. Give Mrs. Smith a message. So he'd go to Mrs. Smith's door, another teacher, and he'd bang on the table really loud, and when she came to the door not very happy, he put his hands to the hips and said, "Mr. Jones wants you in his office now." Of course, he was delivering the message. But the way he delivered it had the exact opposite reaction to what should have happened. He didn't get any thanks. Or you can have another child who doesn't understand the implications of someone's speech. So I was in another school. The teacher saw the child walking down a corridor and said, "This is someone who's 13. Go up the stairs to your room." So he went up the stairs. 2 minutes later, he was coming down the same corridor. And the teacher I was talking to went red in the face and said, "I told you to go to your room." He said, "I did go to the room. She didn't say stay there." You see, so a lot of people interpret the child's action as a challenge to their authority, when really it is not a non-awareness of the expectations implied. So the autistic child, you see this very strongly, of course. Some very severe autistic children, they don't even be touched by their parents. They treat the person's arms as they were a foreign object, like a tree's branches or something. You can have children with autistic features, Asperger's syndrome, of course. The major problem there is their social interaction skills. But the majority of children with these problems in pragmatics, they don't have any label at all. But they may have quite significant problems with pragmatics. Okay, so what do we do in therapy? Effective pragmatics intervention usually includes gradually establishing an insight and awareness through carefully explaining and modelling the appropriate behaviours, giving the child the opportunity to role play those behaviours at home, but maybe to put it in practice, of course, at school, for instance. And the guidelines as to when, where, and with whom the target behaviours are appropriate need to be given and reinforced with praise and other forms of rewarding. So we put restrictions around the behaviours. In a social story on greeting, for instance, we may say, "If they are my family, I may hug them." But we put in, "If they're not my family, I don't hug them." Now, of course, some adults break these unwritten rules to hug the child. And what we're trying to do, though, is establish some rules which, if put into practice in most situations, will work in those situations. Okay, so we create social stories here. We discuss with the child what other people's expectations are and why they expect those things. And then we create folders for them with worksheets, illustrations, and maybe group activities. So sometimes we watch video clips, and I have an example here, a DVD by a speech pathologist, talk about DVD, full of clips of social stories or social activities or skills in there. And we may do conversational skills therapy, so expand what the child talks about and how they introduce themselves, how they join in conversations with others. We may do assertive communication, which is how to express their needs without hurting the feelings of other people, in a nutshell. And now what we're going to do is look at a little movie here. We will expand it up, and off we go. And we can end the video here, please.